Hey guys, what's up? Dr. Rossi, and I'm going to cover another topic here because I just did a video on body dysmorphic disorder, and I think you'll see where there's some overlaps or some overlap with obsessive compulsive disorder. So in this video, I want to just discuss briefly obsessive compulsive disorder, OCD, and some of the details that go along with that disorder. So to start with some basic definition stuff, right? So what are these obsessions that we're talking about? So an obsession is a repetitive, persistent thought, right? So the thought like I'm contaminated and I need to wash my hands. So my thought is everything's contaminated, I'm worried about becoming infected, right? Another example might be images. So the obsession could be in the form of an image, and that would be such as things like violent acts or car accidents like that just keep popping into your head for no reason, you don't really understand it. Another example of an obsession could be something like an urge. And this actually does come up quite commonly in practice, and I have had several cases where people have said things like this. So I'll give the example of wanting to, say, stab someone. You have this, you don't want to actually harm anyone, but you have this like constant urge or worry that you're going to stab, say, your son or daughter, right? So this is a very distressing thing for that person to go through. They have this constant urge to stab someone or harm someone, even though they really don't want to. So again, obsessions can come in a few different forms. They can come in those intrusive thoughts. Hey, I'm contaminated. I need to wash in order to prevent myself from being infected. Another example is the images. I have these persistent images pop into my head of things like a car accident. They're usually things that are negative or horrific, right? They'll be bad things, not good things. Or I have this constant urge, this feeling like I might stab my son or daughter, right? That's another example of an obsession. So that's one component of OCD. The second component is these compulsions, right? So what is a compulsion? A compulsion can be thought of as a ritual, right? This is a ritual. It's a repetitive behavior that I engage in, such as washing my hands if I think I'm contaminated, or checking to make sure my stove is off a number of times because I'm worried I might leave the gas on. It can also be something like a mental act, right? The mental act of something like counting. I have to count a certain number of times, or I have to repeat certain words. So it can also be a mental act. And the individual that does these things will feel compelled to do them. They'll have to do them, right? There's no other way. So they're compelled to perform these in response to the obsession, right? Does that make sense? I hope this makes sense, right? So I'm compelled to respond to this obsession, that's this intrusive, say, thought of contamination. And in order to deal with it or reduce my levels of anxiety, I need to wash my hands X number of times a day to make sure that I don't become contaminated. So hopefully that makes sense. And these things, another important point about these that I'll make is that they're applied rigidly. The person has to do them, right? It's the only way to relieve some of that tension and all right, so a few more things about OCD. Point number one, obsessive compulsive disorder is going to involve, in most cases, both obsessions and compulsions. So most patients are going to present with both, right? The compulsion is aimed at reducing the anxiety and tension associated with the obsession. So it's designed to kind of reduce the person's stress related to that obsessive thought, image, urge, etc. Now, with that said, a lot of times these compulsions are not connected to the obsession in a realistic way. An example I'll give you is arranging items in a certain way, ordering your items in a certain way to protect a loved one from harm, right? It doesn't really make sense. So the obsession is I need to protect my loved one from harm, and the compulsion is I need to make sure, my stuff is arranged on my bookshelf a certain way. So again, doesn't really make sense. And the other important thing about the compulsions is they're clearly excessive. So the person is spending way more time during the course of the day engaging in these behaviors than they should be. So they have the obsessive thought. Let's just go back to the easiest and most common example of contamination. And they're spending, 5 or 6 hours a day taking showers and washing their hands, right? They're afraid they're going to get contaminated. That's the obsession. The compulsive act is to continue washing. And this can lead to other problems too, including physical ones like, chafing of the hands and chapping of the hands, and even sometimes visible sores in some cases. The final point I want to make about these compulsions is that they're not pleasurable. So sometimes people will say to me, well, Dr. Rossi, how come we sometimes talk about addiction or paraphilias like excessive sexual acts? How come we sometimes think of those things as obsessions or compulsions, right? Well, the difference between those things are, and gambling is a great example, let's just use that to kind of illustrate the point. The gambling is done for pleasure, right? The person derives some kind of benefit in terms of how they feel from the gambling, right? That's different than what a compulsion is in obsessive compulsive disorder, because the compulsion's not done for pleasure, right? It's done to sort of relieve the tension and anxiety and distress that the patient's receiving as a result of the obsession. So hopefully this clarifies some of the details for you guys about obsessions and compulsions and OCD in general. If you have questions, please comment below. I'll be happy to answer them. And continue to watch, like, and subscribe to the channel. We'll be updating content on a regular basis.